Okay, yes. Who do we have on YouTube? I'm on YouTube Live, I'm on TikTok Live, and I'm on Instagram Live. Interesting. Yes, you can hear me. Okay, Oyin uh Olamikosi. Okay, good evening. How are you? Who else again? She's Glam. How are you? Who do we have on TikTok? Those on TikTok, if you can hear me, say yes, I can hear you. Yeah, let's go. And who do we have? Yes, Messi. I see you, Messi, on YouTube. Messi is on YouTube. Messi, how are you? Good evening. Welcome. Okay, so if you have questions for me tonight, two people on YouTube, drop your questions. We have people on Instagram, we have people on TikTok. So today is an open day. Ask all your questions. Yes, ask all your questions. Let's go. Hello. Hey, Ehis platform. How are you? Yes, Ehis platform is here. I see you. How are you? Welcome, everybody. Ask me your question tonight, oh. Ask all your questions. If you have any question, ask me. If you don't have questions, and then you just let me know because today is for question and answer. Are we together? Yes. Ask all your questions. How many people do we have on TikTok? Okay, I see you on TikTok or on Instagram. Make una ask now. See, guys, let me say this. Okay, my name is uh, Dr. Frederick Unubohai. We have this program every Sunday by 8 p.m. West African time, 8 p.m. Nigerian time. And I'm not usually alone. I have my friends, my colleagues with me, Dr. Israel, Dr. Blessing. Merit, how are you? So they join me every Sunday and we interact. Now, I've noticed that um, so many questions in my DM, so many questions. People have been asking me so many questions, and I felt, okay, let's make this opportunity for everybody to ask their question. Now, I have one question on YouTube. If you are here and you want to ask me a lengthy question, you can go to my YouTube channel. So, someone is asking me a question here on YouTube. Let's see. Mercy Godwin. So you're saying, can someone with ovarian cyst get pregnant? Yes, Mercy. Somebody with ovarian cyst can get pregnant. That is, if the cyst does not affect both ovaries. Do you understand? She can actually get pregnant. Maybe you are scared and you were told that you have ovarian cyst. But I know there are so many ladies who have ovarian cyst and they have given birth. Do you understand? Yeah. Um, somebody's asking me on TikTok. Your name is Ryaniti. Keep dropping, keep sending your questions. I want to respond to all your questions tonight. Keep sending your questions. So you're asking, what are the causes of cancers and kidney failure in Africa? It's so common now. Well, I wouldn't want to say it's limited to Africa. It's worldwide, but just that the incidence, the rates is now on the high side in Africa. We're not saying it does not exist in other parts of the world, but the rate is on the high side. Now, the reason why this is occurring, number one is that there is more awareness. Okay, I'm coming to your question on YouTube. There's a question here for me on YouTube. I'm going to give the guys on YouTube more priority. So if you have more questions, you can join me on YouTube. So there's more awareness, number one. So people now know, people present early in quote, but not as much as we want. And then another thing again is that poor lifestyle. Yeah, Africans, we have a very poor lifestyle. When I say more awareness, that does not relate to increased health seeking behavior because Africans have poor health seeking behaviors. Chris, how are you? Welcome. I see everybody. So they don't really present early, they present at the later stage when the disease has gone beyond control. So we just do the palliative care. Now, kidney failure is on the high side because of again, um, because of poor lifestyle, high blood pressure, like hypertension, diabetes, my high hypertension, diabetes, um, alcohol intake, obesity, drug abuse. These are substances that can actually damage the kidney. So there's a very high rate of kidney failure and cancers occurring right now. Welcome. If you have questions, ask me your questions though. Ask all your questions. If you have any question, please ask. Okay, I don't think I have any question. Just supporting. Thank you, his platform. Thank you for your support. It means a lot to me. Thank you so much. Yes. So ask all your questions. Dr. Israel is here. Dr. Israel is here. Yes, my co-host is in the house. Thank you for the gift. Ask any question you have, please. If you have any question. Okay, somebody is asking us on YouTube. Rita is asking us on YouTube. It says, let's see. My network on YouTube is misbehaving. So Rita is asking us a question on YouTube, and she says, "Doc, I have tried folic acid, pregnant care, etc., but no sign of pregnancy. What can I take to develop my womb? Please, doctor, answer my question." Okay, very good question. Number one is that we don't prescribe online. We don't prescribe medications on social media. That is number one. So I don't prescribe medications, neither do I make diagnosis. Do you understand? Number two, folic acid and pregnant care does not correct any problem with infertility. So if you have a problem with your womb, let's say you have difficulty conceiving, you have a blocked tube, you have problem with your ovaries, you have hormonal imbalance, folic acid and pregnant care would not correct it. So Rita, my advice to you would be that you go you go see your doctor. Folic acid and pregnant care does not correct infertility problem, or do not. I don't know which one fits in this explanation right now. Is that okay? If you are taking folic acid and if you are taking pregnant care and you have not conceived, despite the fact that you have been on this medication, my advice to you is that uh, you should go see your doctor, see a gynecologist. Yes. Welcome everybody. I'm on Instagram Live, I'm on TikTok Live, and I'm on YouTube Live tonight. Thank you for the gift. Ask your questions, guys. Please ask your questions tonight. Doctor, what are the possible causes of occult bleeding? Don't use this word now. What's your name? Sneak Master P. Don't use this question. Don't use that, please. Um, a layman would not use occult bleeding. So it is obvious you are medically inclined to use this word occult bleeding. If you have a question, ask the question like a patient. Don't come online and start asking occult bleeding. No patient will come to the clinic and say, "Doctor, I have occult bleeding." Does that make sense to you? If you really want to know about occult bleeding, then you should go to Google and search for the answers. But coming online and you are asking, what are the causes of occult bleeding? It shows that you are medically inclined. So don't do that. Don't ask that question. Here is to help those who really want to know the left from the right with regards to their medical conditions, with regards to their health. Is that okay, sir? Don't do that. Don't do that. Don't. You can't come online and say what are the causes of syringomyelia or meningocele or what now, or hemolytic uremia. Why would you using that word for me? It shows that you are medically inclined. So, guy man, no, they do that kind of thing. Ask questions like a patient. Doctor, I dey bleed here and here. Why? Do you understand? Yes, good. Welcome everybody on TikTok, on Instagram. Ask your questions now, guys. Ask your question. There's a question for me on YouTube. Okay, very good. It's like the people on Instagram and TikTok don't want to drop questions. Let me respond to those on YouTube then. I have seen my doctor, me and my man is okay, but nothing. My dog plays on treatment with some of the medicine I share. Okay, good, Rita. Okay. I think what you should do, I don't know how long you have been trying to conceive, but I think at this rate, if you have taken all the medications given to you and there is no problem, maybe you should try IVF. Hmm? Try IVF. His platform, I see you. Consider IVF. Is the network okay? Consider IVF, Rita, because you have done everything possible. They have given you the medications. There is no problem, and yet you're not getting pregnant. I would advise you to try IVF if you can. Hmm? The network is not good. Where? On YouTube? My brother, Abego, network is really bad. Where? Here? The network is bad. Ladies and gentlemen, how is the network? Okay. Imagine somebody they ask us academic questions now, occult bleeding. Make when they ask us academic questions. This place is not for academic questions. So why is the network bad on TikTok? The network is quite okay on Instagram. I don't know why. Dr. Israel, yeah, come up, come up, come up. I've accepted your request. Okay. Yes. So please ask your questions. Ask your questions. Ask your questions. Yeah, yeah. Good evening, pretty good. Yes, Dr. Israel, how you doing? Hello. Hello.
Good evening.
Yes, good evening. How fun? How your side?
Sunday.
Happy Sunday. Happy Sunday. How you doing?
Hello, good evening. Happy Sunday.
Yeah, happy Sunday. I did hear you loud and clear.
Can you hear me?
Yes, yes, yes. I did hear you. Hello. Wetin dey happen? Wetin dey happen? Now this one dey tire me for this network matter. Yes. Okay. So people on TikTok. Hope you can hear me. Abi, Investor Big. Make una ask question now. Please, guys. I don't do DM. I know they do private chats. Hmm? I know they do private chats. You get why? So we create this opportunity for everybody to ask us questions. Make we be chat, make we answer your question. But those when they come my DM, I beg, make una no vex. I know they do DM chats. You understand? I don't stop them a long time ago. I stopped them a long time ago. You understand? If you get questions, you go ask me here. But private chat, I beg, no vex. Good evening. Hmm? Unless you won't pay for my private time, no problem. But other than that, yes, people on YouTube, I can't see your questions though. Ask me your questions. Ask me your questions. Let's go. Ask your questions. Yeah, Dr. Israel, how you doing?
I'm fine. Good evening. Happy Sunday.
Yes, happy Sunday, happy Sunday. Hope you all can hear Dr. Israel.
How's everything?
Very well, though. We did fine. How your side?
Network is not really too good, but I think the network is bad.
My guy
So
is
I
well.
think it's even manageable.
Yeah, Glow. I'm using Glow tonight. I'm
That's
using.
what I'm using now. I wanted to use MTN, but I noticed it's not too good.
Oh, okay, Dr.
So I have
Israel.
to switch to Blue.
Somebody's asking us a question. It says, does checking unborn baby's genotype, how much does it cost? And is the test painful? Okay, checking the genotype of an unborn baby. What is the cost? And is the test painful? Dr. Israel, do you have any response to that?
Okay, I don't have an idea of the cost, but I know it's expensive. Being painful is a procedure. Is a procedure. So every procedure will have a little form of pain and all that because they're going into the body to to get to be able to do that. A little more paid, but the cost of the price, I don't have any idea, but we know it's expensive.
Yeah, yeah. Same here.
Okay, I heard that somebody was asking question like as if we are doing Fiverr.
Okay.
So, and let's know that this is not in this is like a doctor-patient relationship, not like a doctor-doctor relationship or a external examiner and a student relationship. So you don't ask questions that will confuse other persons that will want to benefit from it.
True.
So if you ask some question that even people that would like to benefit from it don't understand what you are talking about, it doesn't make any sense. In a way, it doesn't make any sense.
Yeah.
That's why even if you notice what we are saying, we try not to use medical language. We try to go down to as lay as we can, so that everybody will, to some extent, understand all what we are saying.
Yeah. Thank you. Thank you for saying that again. We try as much as possible to be very basic. We're not relating with doctors here. We're relating with the general public, people who don't understand medical words. So sometimes we even use pidgin to break it down for you to understand in any form you can understand. So please don't use medical words for us. We are not having a medical seminar here. So somebody's asking us on Instagram. If you are just coming, you are welcome. We are doing question and answer tonight. I see you all. Good evening. Helen, good evening. Destiny, how are you? Zion Godwin, good evening. Pretty good. Welcome. Somebody's asking us on Instagram, says, Doctor, in March, I visited the hospital looking pale, and a PCV was recommended to which I did, and the result showed 19%. The doctor recommended me taking blood transfusion up to 3 pints of blood. Okay. After being discharged 6 weeks later, the process repeated itself again. Okay. So, Stephanie, how are you? So, my question to you, since we are on a live platform tonight, we are discussing, we are interacting, everybody. You can drop your questions, we respond to you. Did you go back? What was the cause of your anemia? Why are you losing blood after 6 weeks, despite taking 3 units of blood? I think the most important thing right now is for them to find the cause. It's not about giving you the blood anymore, transfusing you. What is making you lose blood? Do you understand? So let us know, respond, and then um we can advise you. Doctor, your RAN is not working well. My what? Okay. It's been long on your live. Yes, Stephanie, how are you? So, Dr. Israel, do you have anything to say? People on YouTube, can you hear me? Do you have anything to say?
Okay, for that person, one, you want to find out if you're on any medication. Because there's a medication that I know that one of the side effects is causes anemia. So, want to know if you're in any chronic medication that can be causing that. Also, I think you need an hematologist review.
Yes.
And when I mean hematologist, I mean people that are specialized in blood diseases and all that. There are doctors that are specialized in that. So they need to review to find out if you are able to produce red blood cells. Because sometimes if you are not able to produce red blood cells, that's when you'll be going back having such issue. Also, if you are a sickle cell patient, you may be having such, but I don't think you are because your PCB is 19, your doctor is saying you should get like 3 pints. Well, you never can tell. You need to know your genotype and see an hematologist to know what really happened and to know what really happened. And if you are on medication, chronic medication. When I mean chronic medication you are taking for a long time, you also need to review those medications.
Okay, Dr. Israel. Okay, guys on TikTok, can you hear me? Can you hear Dr. Israel? Please respond. And we have a question on YouTube. I'm going to respond to the question on YouTube, Dr. Israel. So the person on Instagram is saying it also happened the third time, and a stool test was prescribed, and the test proved that I have blood in my stool. So, like Dr. Israel has said, you need to see a hematologist. You need to see a hematologist, and the hematologist would help you look for the cause of your anemia. Do you understand? You are diabetic, okay, but I think you need to meet a hematologist to help you make a diagnosis. Do you understand? Okay, those on TikTok, can you hear Dr. Israel? Dr. Israel, we have a question on YouTube. So this question says, I believe you can hear me. It says, "Good evening, doctor. Please, I just suddenly stopped adding weight. My chest region just became dry, and my breast, I lost elasticity and muscle. Please, what can I do? I don't do test tire, even hormone tests." Uh,
Sorry. Can you read the question again?
okay, so let me read the question again. It says, "Good evening, doctor. Please, I just suddenly stopped adding weight. My chest region just became dry, and my breast, I lost elasticity and muscle. Please, what can I do? I don't do tests, tire, even hormone tests."
How old is this person? You lost weight. You're looking dry. What kind of test did you do? Let's leave hormonal test out of this. I don't think you have any business doing hormonal test based on what you just said. What kind of test did you do? Did you try to check your status? Are you coughing? Did you try to do any tests, any investigation that would suspect cancerous activities? Did you try to do investigation? So I think that's the line you should go. Not I don't think the hormonal test will do any better for you at this point. So you need to say to look for to go to a teaching hospital, because this is not something one doctor would want to do. It's something of a multidisciplinary approach, because investigation before we'll be able to place which doctor will actually be in charge of your case. But let's know the right test to do. That's the first thing. So as I said, you want to know your status. You want to check for TB status as well. You want to because you want to even know. Dr. Fred, are you there?
I can hear you. Hello.
Dr. Fred.
Yes. I can hear you loud and clear.
Dr. Fred, are you there?
Oh God, this network. What's going on? I can hear you now. You're loud and clear. It's sad that every time we keep having these network issues. I don't know why. I don't really know. Despite the fact we try to correct this. Yes. Those on TikTok, can you hear me? So what we are saying, someone is asking us a question on YouTube, and I don't know if you can hear us, Judith, if you can hear us from YouTube. So by the way, who referred you for this your test, your hormonal test? Have you seen a doctor, Judith? My blood was all negative, no problem. Okay, have you seen a doctor? Doctor, can you see my question? No, I can't see your question, Stella. I can't see your question. You can ask me a question on YouTube. TikTok is blocking your question, Stella. I can't see your question. Huh? It's not appearing on my screen. You said internet is bad. Yes, okay. Judith, yes, okay, you can hear me. Very good. So, Dr. Israel was advising you. Can you hear me now, Dr. Israel?
Yeah, I can hear you.
Okay, good. So, Judith is listening to us right now on YouTube, and she can hear us. So we advise you, please, in case you are trying to carry out this test on your own, you are doing the wrong thing. Try see a doctor, and most especially if you can go to a teaching hospital, a tertiary center, where you have different groups of doctor and that can help you make adequate diagnosis. Yeah. Okay. So we have another question of Israel on YouTube. There's another question here on YouTube from Olabisi. He says, "Hi, doctor. Please, is it possible for someone to have sickle cell without being SS?" Hello. Hello, Dr. Israel. Oh my God, what is going on now? Ladies and gentlemen, somebody should recommend a better network for me. So, yes, Olabisi, you said, is it possible for someone to have sickle cell without being SS? You see that word, SS, sickle cell. Anybody who is not SS will not develop or will not be a sickle cell patient. Do you understand? Though we know we have other variants. There's SC, there's SC, there's AC, and sometimes they can also develop little crisis. But somebody who is SS has sickle cell. Do you understand? Sickle cell. So you have to be sure exactly what the genotype is. What exactly is the genotype of that fellow? If the genotype is SS, then it's a sickle cell. But if the person has crisis, also Israel, are you there? Hello.
Hello?
Yes, can you hear me now? Hello. Hello.
Yeah, I'm hearing you. Can you hear me?
Yes, I can hear you. I can hear you.
Okay.
So somebody was asking, he said, is it possible for somebody to have sickle cell without being an SS?
You can have other variants like SC, which is also a variant of sickle cell. ST, yeah, SC is like you have the traits, yeah, just like AS, you're having the traits of sickle cell in. And when we say traits, it means that you have something can give someone that makes somebody SS. Yeah? So that's what it means. Okay, that's something you can pass on to someone.
Okay.
So you can pass on
Okay.
to
So let me read the follow up. Let me read the follow up comment here. So he says, was told I have Thelma whatever. Thelma, that is sickle cell stuff. These people just want to drive me crazy. So I think what they told her is thalassemia. Thalassemia. I think it's thalassemia.
Okay, thalassemia.
Yeah, I think it's thalassemia. And they told her. So she doesn't understand, and maybe she hasn't heard of it before. So it looks as if it's a very something and it's making her go nuts. So what I'm going to advise you, obviously, and calm down, calm down. Yeah, respond a bit. Go ahead.
Thalassemia is a blood disease. When you have such thing, that we always say, okay, even a sickle cell patient should also need to see an hematologist. Someone with thalassemia, we also need to see an hematologist so that they can put you in the right line and what to do. I don't know how the person that told you that you have thalassemia, how he did the test, child.
Where are you based? Where are you based? Olabisi, where are you? I think this person is not in Nigeria. I believe this is not in Nigeria.
Yeah. I don't know how you did it. Except this person, except because in Nigeria, but I think she should need to say hematologist.
Yeah.
Hematologist will actually give you the best treatment from thalassemia and all that.
Okay, yeah. So, Dr. Israel.
I don't know how
Dr. Israel. Dr. Israel, let me read the other comment again. So He's saying
Yeah.
after about 150 tests in the United States of America. So I think she's in the US. Yes, she's in the US. I'm in the US. Okay, yes. Okay. After 150 tests in the US. Okay. So you have thalassemia, and it's not something we can readily diagnose in this part of the world. Not that we cannot, we don't really have enough um, enough technology like that, but it's possible to diagnose it here in Africa. So it's thalassemia, thalassemia. There's thalassemia beta, thalassemia alpha, and the rest. So that is what you have. Nobody's driving you crazy, and so many people don't have it.
It's not sickle cell. It's different from sickle cell.
Yeah, it's different from sickle cell. Yeah. Yes. Okay. Good.
Sickle cell.
And they can break it down for you. Good. Oh yeah, ask your question. So we are moving. I like this. So many questions. You can join me on YouTube, Stella, and ask your question on YouTube. If I can't read your questions here, drop your questions on YouTube, and then we'll respond to you. On YouTube, I can actually see all your comments and all your questions. Yeah. Yeah, let's go. Ambrose, welcome. Joy, welcome. Ask your question. Okay, Israel, do you know that my DM is so full, and in a bid to respond to so many questions, we try to come online like this so that we can respond to so many people. You can't really respond to questions in the DM, or when I say DM, private chats, inbox. I know they do.
If you are responding to private chats, it simply means. Hello, are you there? Are you hearing me?
Okay, say it again. Say that again. Say that again.
I said if you're responding to private chat, it simply means our aim for this program, we'll not be able to meet our aim.
Yeah.
Our aim is not for a particular person, for the first place.
Yeah.
So, your question will help us to educate others and also educate you yourself. That's why we say, okay, ask your question, and I will be able to tell you everything we think you can tell you.
Yeah. Yeah. Okay, welcome everybody. If you cannot hear me, please move to YouTube. If I can't see your questions, please drop your questions on YouTube. So on YouTube again, Olabisi is saying, okay, yes, I wanted to go for IVF. So I was given a list of 152 tests. So when it got to the sickle cell stuff, I gave up. No, now come on, you shouldn't give up. You shouldn't give up. These are routine tests. These are very important stuff that in the US now.
Okay. That's how they will give you. In fact, you've not started doing tests.
Those are broad. Those are yes.
Even when you finally agree to do the IVF, after the IVF, that's how you'll be doing investigation upon investigation to monitor the baby and yourself and all that. So this investigation you do, majority of them are just routine investigation for them. They do it for almost all their patients, just like that. It's not like it's because you are giving. Most of the time, most of those investigations are their routine investigation.
Yeah. And again, if I may add to that,
I hope it's covered by your what they call NHS.
NHS insurance, health insurance. I don't know. We have no idea. It is covered by the insurance. If you are just coming, you are welcome. We are on Instagram Live, we're on TikTok Live, we're on YouTube Live, and I've been having so many questions from YouTube. Dr. Israel, we have another comment on YouTube from Judith. Judith says that okay, the lady that complained about the breast, remember, right? Hello, Dr. Israel. Oh, your network. Okay, this is This is very interesting. So Judith on YouTube is asking us, or she's commenting. She's saying that a doctor recommended the test. Progesterone was low, but I just weaned my baby as at when I ran them. But I will still visit the teaching hospital as advised. God bless you. Yes, God bless you too. Okay, so you just weaned your baby, progesterone is low, and they did the test. Okay. It's better, as we have advised you, that you go to a teaching hospital. In a teaching hospital, you have so many experts there, and they'll be able to help you. Yes. If you are here and you cannot send questions here, drop your questions on YouTube. I would respond to you. I can see all your comments, and it's very, very interactive. I can pin your comment on the screen. Olabisi is responding to us on YouTube. Olabisi says, "No, I'm doing self-pay. Medics so expensive here. Oh, healthcare is so expensive in the US. Wow. Wow, you're making out-of-pocket payments. For those abroad, they test almost everything. They test almost everything. They want to test. They want to test. They want to test. They want to test. So I think that is why they want to check. And then Olabisi is asking us again on YouTube. Olabisi is asking us on YouTube. So for those who are not on YouTube, you can go to YouTube. You'll see so many comments there. Yes, you can join us on YouTube. Olabisi is saying, Doctor, could there be an unexplained fertility issue, please? Yes, it's possible. Yes, it's possible. Sometimes the man is okay, the woman is okay, but there's no known cause, unexplained. Unexplained fertility issues. Yeah, unexplained. So,
The lady that said is paying out of pocket, she's actually trying. Healthcare outside this country is not being the US, and I have a friend that have to come back. Is it US? I've forgotten the country. He said that US also. Just for a cataract extraction. The money was saying, so you have to come to Nigeria to do it and go back. Because it was
permit me,
really,
to Israel.
that's why their health insurance. That's why most of them use health insurance, because that's what covers a lot of them.
Israel, permit me to use this opportunity to praise Nigerian healthcare workers. I want this opportunity. People look down on Nigerian doctors, nurses, pharmacists, not understanding that some people actually live abroad and come to Nigeria. When people want to go abroad, the reason why it's functional over there is because there is a system. There is a system that works. They have almost everything to make them perform very well. So I'm not going to use this medium to bring down my people. Nigerian doctors, nurses, pharmacists, lab technicians, and the rest are excellent. Whenever they go out of this country, I'm sorry, sir. Lab scientists, they are very excellent. When they go out of this country, they do very well. Yeah, and that is why.
Marvelously well.
Yes.
Most hospitals outside this country, because of what we have learned from our country, and I will pass through. I will pass through needle eye of a needle, even just to get what we want. That's why when we go outside this country, we do very well. We do very well.
Okay, welcome.
As you earlier said, just that the system in this country is not helping anybody. It's not helping anybody, which I think is we need everybody in the health sector needs to sit and make it work. It's not about trying to say who is the leader or who ends this. It's not the time for that. But it's time to make sure that everything works so that we can get the best for everybody.
Okay, so somebody's dropping a question again on YouTube. Okay, Olabisi says, okay, let's do this first of all. There are two questions on YouTube. The people on TikTok, on Instagram are not asking us, so let's focus with those on YouTube. Says, okay, I pray God intervene Seriously, a friend had to come back home to do her IVF. Though I guess it didn't work. It's about $12,000 here. Thanks to Nigerian doctors. $12,000. I believe in dollars.
You know what $12,000 is?
Hmm. That's about 10 to 14 million naira, or about 11.
You know the funny thing, yeah. Let's even though you don't want to convert it, for them to get $12,000 in US, it's not like getting 12,000 naira in Nigeria.
Yeah, you're right. You're right.
That's to tell you how expensive it is. It's not like getting 12,000 naira in Nigeria. You need to work. You need to work yourself. You're not in a, if you have a very good job there, you need to work for a long period before you can get such amounts to do what you want to.
Dr. Israel, we have another comment on YouTube. The people on TikTok are not asking us anything. They're just looking at us. So let's focus our attention on those on YouTube. If there's a way to put the two of us on YouTube, I would have done that, because people on YouTube on TikTok are not asking. So let's answer Iberi. Iberi is saying, please, doc, what is the sign of early pregnancy? Can someone also know the sex of the child when it's still in the stomach? Thanks. Iberi. So Iberi is saying the early signs of pregnancy. So let me respond to this quickly before Dr. Israel. At the very early stage of pregnancy, listen carefully. For some ladies, there might be no sign. They might not even know at the very early stage. You understand? They might not even know at all. Why? For some, the only sign they might have is that they are just feeling weak. For some, they are feeling tired anyhow. They want to vomit, nausea. For some, they are averse to smell. So there's no specific, but at that early stage, you could have different array of symptoms. You understand? Why? For some ladies too, they might have no symptom at all. They are just okay. First month, second month, maybe towards the third month, they begin to discover that there's something going on, and then there might be loss of period, cessation of their menses. So, Israel, anything to add to that?
Okay, I think cessation of medicine is the first thing. That's the first. Let me say that's the first symptom
Yeah.
that anybody will want to say. And apart from that, I don't think there's any specific symptoms for pregnancy, but symptoms that people can actually feel that they may be very tired, having breast pain, pain, and fullness of breast. The breast can be full, it's painful. They may be vomiting, can be having vomiting, fever, tiredness, and nausea. That is feeling like vomiting, nausea, and also they stop seeing their mess. Like yes, they are pregnant, because these signs, these symptoms we said, and we are saying, you can also see them in other you can see them in some illness.
Okay.
No, it's not to they need to pregnancy test. So when you do a pregnancy test, if it's positive, it shows that you are pregnant. It shows that you are pregnant. Yes, you can actually know the sex of your child from scan. From scan. But that's what they call it. Is this suggestive?
Yeah.
It's suggestive because it's what the person that did the scan sees. That's what it's going to tell you. And that's what it's going to tell you. So if it's not saying it clearly, I just tell you what is not what is not it.
Yeah.
But most of the time we actually get it correctly, what is actually the sex of the child. So it scan with good scan, I think we'll be able to give you the sex.
Yeah. Oh.
However,
Yes.
let me say this, if you're in Nigeria, however, if peradventure a doctor tells you that you're going to give birth to boy, and when you get to the hospital, that very day, you find out that you give birth to girl, don't go and start fighting the nurses that you don't know. The scan said I'll give birth to boy. Remember what I said suggestive, that it's what the person is saying, what the thing he saw, that's what he's telling you. It will not be
100%. Yeah.
correct. Not 100% correct. So sometimes that's why after delivery, what the midwife or the doctor that conducted delivery will do after once the baby comes out, show the babies to the mother and ask the mother what to give birth to, so that the mother will not think that somebody changed their child.
Yeah.
Because we've seen some cases where investigation, the test, the scan the mother did or the woman did says it's a boy, and actually this woman was actually looking for a boy, a baby child, and during delivery, we find out that it's a girl, and the woman was furious that they changed her child, whereas nobody changed the child, it was just a misdiagnosis of the scan of what the scan said. So yes, we can actually see the sex of the child when you're pregnant, and those signs we said are just like the early signs of pregnancy. But doing a pregnancy test and a scan.
Okay. So, Dr. Israel, we have so many questions now, and let's try to see if we can be very fast. Let's take those on YouTube quickly, because we're giving the YouTube guys high priority tonight. The cheapest in UK is $12,000. Okay. So somebody's asking us on YouTube. Let's make it very fast. We have some questions on TikTok and on Instagram. Doctor, please. I do feel some tenderness in my breast, but not pregnant when I test. This happens every month until after my period. I hope it's not an issue. On tenderness in your breast, if it's close to your period, it might be your premenstrual syndrome, a sign that you're getting close to your period. Do you understand? If you feel tenderness in your breast, maybe towards your period, and then after your period is over, you are fine. It's just like the sign. These are signs you see towards the time of your period, and when your period is over, your breast is fine, no issues again. The last one on YouTube before we go to TikTok. Please, doctor, what position of sex is best if trying to conceive? Please, maybe I'm not doing it right. What position of sex is best if you're trying to conceive? My dear, any position, oh, as long as the sperm can find its way into the uterus, then the fallopian tube, from the vagina down to the cervix to the uterus, fallopian tube. So any position, the most important thing is that the sperm is getting in. Whether you put your head here or you put your leg down, any position, as long as the sperm gets in. So Israel, please react to that quickly. Let's go to yeah.
Okay, and as Dr. Fred has said, there's no position. What you should be concerned about is one, how viable is the sperm? Two, how often do we meet?
Correct.
Three, do I meet when I'm ovulating or I'm just meeting for meeting's sake? Because even though the sperm is viable and you are not meeting when you are during your ovulation period or the fertile period, there is no way. Dr. Fred, are you hearing me?
Yeah, I can hear you.
Okay. There is no way that you can become pregnant. It's just like shooting antiviral. Yeah? So these are things you should be considering, not the style that you should take. So any style you take, so far the sperm find its way inside, and once it's able to find its way inside, it can get the woman pregnant.
Very good.
So if you are looking for a child, first of all, you also have to do tests to find out how viable the sperm is. You want to know how often you meet, so you should be meeting at least 3 to 4 times a week. Then 3, you must try and know your ovulation period, your ovulation time. So
yes.
Most of the time you target that time for your sexual activities. So if you target that time, luckily you may become pregnant. And so if you okay, let me stop at that.
Okay, yes. So the most important thing is that you meet at the right time, your ovulation. So we have 2 questions on TikTok, then we go to Instagram. We're on YouTube Live. TikTok Live, Instagram Live. Very soon, we're going to be on TikTok, Instagram, YouTube, Facebook Live all together. Someone is asking us a question here. Says CEO Abe says, is it good for someone who is pregnant to be coughing and be urinating at the same time? Quickly react to that, Dr. Israel.
I did not get it.
Okay, is it good for someone who is pregnant to be coughing and urinating at the same time? Is it good?
I'm not hearing.
Oh my God, network. Okay, let me react. I don't know why the network is doing this to us every time, every time. It's not good actually for a woman to be pregnant and coughing. You know, whenever a woman is pregnant, there is pressure already on her bladder. So when you cough, the pressure in your bladder in your abdomen increases again. The baby will push on the bladder, urine will come out. Unless you have a problem before with your bladder. But when a woman is pregnant, the uterus, the baby is now so big towards in the third trimester, and you cough. When you cough, there's increased abdominal pressure, and together with the baby there, that baby together with the pressure when you cough will press the bladder. Small urine will come out. Drops out. Yeah. So the most important thing is to address that cough. You address the cough, you can help. So when you cough and you see that urine comes out, it's not like there's a big problem. It's from that cough causing you the passage of the urine. Okay, one more question on TikTok, and then we go to Instagram. She has taken all the medications given to her because of the cough. Let her go back to see her doctor. I have not seen my period this month. I want to know what is the cause. Faith, you have not seen your period this month and you are wondering what is the problem. So let me give you a quick answer. Go to my YouTube channel. I have a video on my YouTube channel on delayed causes of period. There are many causes. A woman is not pregnant and yet her period is not coming. What are the causes? There are so many of them. So go to my YouTube channel, Faith, and watch the video about 10 minutes, 15 minutes there about. I think it will help you a lot. You understand? Don't just sit here on TikTok and think you will get all the answers. Some of them are already online. Dr. Israel, are you hearing me now?
Yeah.
Okay, so we have a question on Instagram. We have a question on Instagram that says, how can one reduce uncontrolled urination at menopausal age? Uncontrolled urination at menopausal age.
Okay, if it's a male, you need to go and
no, menopausal age.
Oh, sorry, menopausa, female. Sorry. I don't think of me. Menopausa. Okay, for a lady having uncontrolled urination in menopausal age, I think you need to see a gynecologist. Because the majority put the bladder. The majority problem with the bladder. So
Yeah.
you need to see a gynecologist.
Yeah.
And sometimes the approach is the person can still determine that. It cannot be that because the person is not too old.
Yeah.
Some persons may not they want to pass. But I think you should say gynecologist. That person.
Yeah, if I may add to that, not being able to control urine at the menopausal age, sometimes it might be urinary incontinence. You understand? That is just urinary incontinence and might also be associated with menopause. You understand? Towards that age, incontinence, repeated childbirth, and the rest. So a gynecologist will be in the best position to help. One more question on Instagram. We're almost out of time. Is there any symptom to know when the semen is not vital enough to impregnate a lady? Is there any symptom?
Just go and do sperm analysis. That's how you will know. Just do a sperm analysis, then you will know. However, no matter how small the sperm, and as far as there is a cell, and you're able, you meet your partner as at when he's ovulating, there's every tendency that he will also can become pregnant. No matter how, because we just need one of the sperm cell. That's what the egg is to become fertilized. So if the sperm cell, even though it's not as many as we think, but it's viable, and it can move, and the lady is short period, yes, it can still become pregnant. But you just need to do a sperm analysis.
Yeah.
That's the way you can find out.
Thank you, Dr. Israel. If I may add to that, there are two things here. There is a young man, he's not married. He wants to know if his sperm is okay. The only way for you to know is for you to go and test, go for a seminal fluid analysis. You are a man, you are married, you want to know, you have been trying to get pregnant. The only symptom that would make you know is that you can't impregnate your woman. There's no other symptom again. So, like Dr. Israel has advised you, go and see a doctor for a seminal fluid analysis to break it down for you. We would not encourage you to go carry out tests on your own without seeing a doctor. Do you understand? We would not encourage you to go carry out the test just because it's out there. It's important you see a doctor who would relate with you, examine you, and provide the best test for you. When you do the test, you come back with the result, and the doctor reviews the result with you. It's surprising that so many people have been asking me questions in my DM, but they are not online today to ask their questions because I want to respond to them. Loretta, how are you? So, what could lead to discharge in guys and abdominal pain? Discharge. A guy is having discharge. The most common cause of discharge in a guy is infection. The most common cause of discharge, penile discharge. And good evening to those on YouTube. I see you all. It's most likely an infection. Yes, it's an infection. The most likely cause of discharge in a guy is due to an infection. Yeah. Okay. Good evening. Welcome everybody. We are almost out of time tonight. We are almost out of time. Oh, if you want to ask us now. We have about a few more minutes and then we are done tonight. I think we'll be having this session once or twice in a month. For those that want to ask us any questions, please, you can ask. For those on YouTube, no question on YouTube. Okay, very good. Ask your questions. Ask your questions. We are here to respond to you. And encourage your friends. Encourage your friends to come and follow me. Let them click on the follow button. Let them follow us. Let them join this live stream, and we'll answer you. Okay. Good evening. Good evening. No question again. Dr. Israel, your network. Yes, I see you. Loretta, good evening. How are you? She has taken all the medications given to her, but it's not working. And let her go back and see her doctor. Dr. Israel, I wanted to ask a question. Please ask your question quickly. We are almost out of time. We spend just 1 hour here. We keep to time. We keep to time. 8 p.m. on the dot. We are live. 9 p.m., few minutes past 9, we are out of here. We are very, very respectful of our time. We know they joke with time at all. So go ahead, ask your questions. Okay, I can't see any question again. Oh, let's see. Anyone here? Okay, everybody is doing very well. Drop your questions. Tonight has been very, very, very okay. Someone is asking us on TikTok. Can you hear me?
Yeah, I can hear you.
Okay. Somebody's asking or says, "Hi, doc. Most time I do ask more about hepatitis. A friend of mine was tested positive. So, what is your question exactly? What's your question? What's your question? A friend of yours tested positive to hepatitis. Okay, so what is your question? Let's help you and advise you. Let's help you. My DM, my DM is a mess. So no vex. So, ladies and gentlemen, I know they respond to DM messages. Do you understand? It's it's a decision.
Your friend tested positive. Like if you go to the hospital, they need to do more investigations, and so they will know if it's what they want to start treating, or they will tell you that just calm down. If they will tell him or her to just calm down.
Okay, so here's the question. Here's the question, Dr. Israel. So it's asking, is it possible for him to be cured? Is it possible for your friend to be cured? See, there are two types of hepatitis: infective hepatitis and non-infective. If your friend has an infective hepatitis, which of the viruses is it? A, B, C, D, E? If it's B, B does not have a cure. B can only be managed. But if it's C, C can be cured. A and E, most times you manage them, they disappear after treatment. But B, for now, has no cure. Hepatitis B has no cure, sir, but it can be managed. And very importantly, permit me to add this. There are so many people online, so many people on Instagram, on Facebook, and whatever. They will tell you that they have a cure for hepatitis B. My guy, or my sister, or my friend, it's a lie. You will waste your money, as in, you will waste your money. I can guarantee you that one. There is no cure for hepatitis B, whether it is acute or chronic. Yeah. Okay. Last question here, and then we are off for today. Last question from YouTube. But it can be managed, my guy. If they can manage it, the person will live very well. Let this person go to the hospital and see a gastroenterologist. Please, doctor, I feel something going up and down my throat. Can I take warm expelling tab? Something going up and down your throat, up and down your throat. Okay, see my answer here. If it's been a long time, you deworm. If it's been a very long time, no problem, you can deworm. I'm not saying that that is the cause of the substance, so but if it's been a very long time, let's say 6 months and above, you can deworm. And then if after you deworm, you still feel that sensation, please see your doctor. I don't want to talk about the likely causes, this and that. It could be globus. It's what we call globus. But take your warm expeller if you really feel so. If it's been 6 months and above, it's in the warm, no problem. Take your warm expeller, and then after that, if you feel fine, no problem. Questions. Is there any cure for yellow substances coming out from the gland area in the mouth? No, no. You have to see a doctor. Ambrose, I don't really know what you mean by yellow substance from the mouth. I don't know what you mean by that. We are almost out of time. What is hepatitis B? What is hepatitis B? Wow. Hey, we are out of time, guys. We are so out of time. So Israel, Alpha, can you hear me?
Yeah, I can hear you.
Yes. It's past 9, 4 minutes past 9 here. So let's round up tonight. Let's not go past our normal time limits. You understand? So what would be your general advice as a round up? Hello, Dr. Israel. Hello.
Okay. What? Are you hearing me?
Yes, I can hear you now. What will be your advice? Yes. I can hear you. This network issue, eh? This network issue is it's crazy. I can hear you. Yes.
Can you hear me?
Yes, sir. Go ahead. Continue. I can hear you.
Can you hear me?
Yes, 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 yes. Wala. You know what they call wala? You know what they mean by wala? Wala now when network decides to attack you. Ladies and gentlemen, I want to appreciate every one of you for your time and for joining us tonight. Um, you guys are awesome. Thank you very much. To those on YouTube, thank you. Those on Instagram, those on TikTok for asking us all your questions. I want to say thank you. I hope I can post this video online on YouTube so that those that missed it can actually go back and watch it again. Yes, and very importantly, I keep saying this. Please, I beg everybody, no vex, no vex. I beg, I beg, I beg. Um, People send me private messages in my DM on Instagram, everywhere. I beg, no vex. I know they do private message. Hmm? I know they do private message. I know they private chats anybody. I know they do DM consultations. I would advise you to go and see your doctor. Wherever you are in the world, please go see your doctor. But if you insist that you must speak with me, please, you will have to book for a consultation, online consultation, and you will pay for my private time. Other than that, my private space is my private space. I beg you. I love you. I respect you. And I want to ensure that you are fine and you're well, you take your health seriously. But at the same time, I also respect my private space. You understand? So thank you guys for your understanding. Thank you for always coming to the live stream. Thank you for engaging with my content, with our content. Thank you to Dr. Israel for always being here every Sunday. Always been here. We say a very big thank you to you. You can follow him. His handle is doc.israel. So you can follow Dr. Israel too. He's on Instagram and he's on TikTok. Doc.Israel. Please follow him and I'll see you all next week Sunday. Like I always tell you, good life. Good life. Not sense. Take care of yourself and have a lovely week. God bless you. Bye bye. Fine. Fine.